you doing today?
I'm good, how are you?
I'm good, thank you for asking. My name is Keegan, I'll be your student physical therapist today. From your chart that I was reading earlier, you've been recently diagnosed with COPD, is that correct?
Mm-hmm.
Perfect. I'm just going to perform some tests and measures just to make sure everything's functioning properly and help keep track of progress during physical therapy. Does that sound okay?
Mm-hmm.
Perfect. And then during the exam, I am going to have to ask you to take off your shirt just so I can get a better reading of your chest movement and listen to your lungs. And I might also ask you to lift up some breast tissue if that's okay as well.
Yep.
Okay, first I'm going to listen to your lung sounds, also known as your lung auscultations. I'm basically just listening to any abnormalities throughout your lungs. If there's any like crackling, wheezing, no sound at all, just making sure everything's symmetrical and everything's working properly. Perfect. And then I'm going to have you take a big deep breath in and big deep breath out with your mouth open. And you can start once I put the diaphragm on you. Okay. Perfect. And then for this last part, I'm going to have you bring your breast tissue up a little bit. Thank you. Thank you. And now we're going to repeat it on your backside. And then same thing, I'll have you take big deep breaths in and out using your mouth. And if you don't mind, I might have you push up the back of your bra. Thank you so much. Thank you. Okay, next I'm going to test your lateral costal expansion, basically just seeing how your chest wall mobility is working. With COPD, we do see that this is decreased and just want to make sure how you're doing with that. Perfect. And then for the first one, I'll have you lay on your back. Perfect. And then I'm going to go around to this side. Perfect. And then I'm going to place my fingers along the lower of your ribcage if that's okay. Perfect. Beautiful. And then just take a few big breaths in and out for me. Thank you. And I'll have you lay on your stomach now, and we'll repeat the same thing. And then I'm going to have my hands find your lower ribs if that's still okay. Perfect. Yeah, whenever you're ready, just take some few big breaths. Thank you. This next part of the exam, I'm just going to see if there's any accessory muscle use. Basically, whenever we're breathing very extra hard, we tend to use some secondary muscles that aren't typically used in normal day-to-day quiet breathing. So I'm just going to have you take some normal breaths in and out while I observe, and then I also might palpate a muscle on your neck called the sternocleidomastoid, if that's okay with you. Then I'm just going to palpate that muscle to see if it is activated while you breathe. Perfect. And then on the other side. Thank you. So I'm going to be doing today is just seeing how your dyspnea or shortness of breath is doing with COPD. I have this scale here that goes from 0 to 10, 10 being drowning level, needing to go to the ER emergently, and then 0 being just sitting quiet, nothing going on, and then 5 would be you are doing quite a bit of activity, but you could definitely do a little bit more.
Right now, I'd say I'm like a 1.
Okay, sounds good. Throughout PT, we're going to be using this chart just to see how you're feeling with activity, but for now, just kind of keep that in mind. Do you have any more questions for me today?
Nope.
Okay, thank you so much. Have a great day.